Well, welcome to the National Diabetes Prevention Program webinar series titled Develop a Quality Sustainable Extension Program in Your State. This is the fifth webinar in a series that we have put on for cooperative extension personnel who are interested in conducting the diabetes prevention program. Today's topic is adapting the National Diabetes Prevention Program for diverse audiences, and I hope you're going to enjoy what we present today. So the webinar will start off by just giving you a really brief orientation to what the Cooperative Extension NDPP interest group is and what we're trying to do. The second thing is we'll have a speaker from the CDC talk about marketing the lifestyle change program to diverse audiences. And then we have two individuals who have conducted the diabetes prevention program with diverse audiences, and they're going to be providing you their perspective on what they have done with that program. So one with DPP, providing DPP with Native American audiences, and the other with the Hispanic community. And after that, we will have a time for question and answer. Just some housekeeping rules. Your camera and audio have been turned off because with larger audiences it's harder to, sometimes you have the reverberation with the audio noise. And so we do want to have you very engaged in asking questions, and we ask you to please use the chat box feature of Zoom in order to do that. And you can usually access that by moving your cursor up or down, and you should get this drop down, and then the chat function will be there. So there's a Q&A function and a chat function. We're going to be monitoring the chat box function. So if you could use that, that would be helpful. This webinar is being recorded and will be available on our website at ce-dpp.extension.org. But I'll also send out a follow-up email to everybody providing that link for you as well. So today's presenters, I'm Carlin Raffi. I'm going to be just the moderator for today's session, but our speakers are Alexis Williams from the Centers for Disease Control and Prevention, Janice Herman from Oklahoma State University Extension, and Antonio Villa Payares, who is the founder of La Casa de la Salud. Real quickly about the Cooperative Extension NDPP Interest Group. We formed in 2016 with the goals of increasing the number of state cooperative extension services who are fully recognized as national DPP providers, and to strengthen our ability and capacity to impact diabetes prevalence in the United States. We started off with 7 southern state extension services, which has now expanded to participants in over 16 states nationwide. And this is just a quick map showing you where we have members in the nation. If you don't see your state highlighted in blue, we'd love for you to think about joining us and be part of this map that we're trying to turn blue. We're trying to turn the map blue. Our interest group has 4 working groups currently with their own goals. We have a quality support group. This webinar is being produced by the quality support group to try to help support extension agents and other personnel to conduct quality programs. We have a common evaluations work group, a work group on how to set up systems for Medicare reimbursement and claim submission, and then we have a communications work group as well. If you'd like to connect with us, we have our website. The URL is there. You can contact me. You can contact Vanessa Da Silva. And at the end of the session, I'll also provide you the contact information for Janice, who's going to be one of our presenters today. So without further ado, I'd like to introduce you to our first speaker, Alexis Williams. She is a public health advisor for the Health Education and Promotion Team in the Division of Diabetes Translation at the CDC. The focus of her work is developing and delivering training and technical assistance around health promotion and health communication. She works with the CDC-funded programs, partners, and community-based organizations to help strengthen their capacity to deliver effective diabetes prevention and control programs. Prior to coming to the CDC, Alexis managed the National Dissemination of Body and Soul. Some of you all may be familiar with that program. Body and Soul helped African American churches develop healthy eating programs for their congregations. And she also worked as public health advisor for the National 5 a Day for Better Health campaign. So without further ado, Alexa, Alexis, I'll turn it over to you if you'd like to share your screen.
Okay.
Are you working that out?
Yeah, it says.
I can stop sharing
Yeah,
mine.
I think you have to stop
there you
sharing
go.
yours. There you go. Okay.
Go ahead.
Whoop. Okay, can you see my screen?
Not yet. Did you hit the share button? You have to click on it and then hit share. If not, Alexis, I think I've got your latest PowerPoint up and we could work with that one.
Okay. We might have to do that because I seem to have lost the controls for the meeting.
Okay, so let's see if I can actually, I'm sorry for this delay, everybody. Hold on just a second. Let me see if I can share Alexis's presentation and we'll work with that. Okay. So I'll do my best. You tell me when we need to flip the slide, Alexis.
Okay, sorry about that, everyone.
That's okay.
Thank you for inviting me here. I'm just going to share with you some lessons that we've learned about marketing and engaging priority audiences in the national DPP over the last few years. So next slide. We'll talk about strategies that have been successful, including how you get the right mix of activities and approaches to messaging that seem to be more effective. So one of the important things to share with you is what we've learned about our audiences and how to market this program to them. And one of the main lessons learned is that our audiences live in really noisy environments. They have a lot going on. So not only are they experiencing marketing from other products, other lifestyles, other choices out there, but they have busy lives. They're taking care of family. They have sometimes multiple jobs. They have stressful environments they live in. And it's really hard for them to pay attention to our message when their environment is so noisy. And so they need to be exposed to our messages multiple times. They're not just going to see a flyer or a billboard or hear a message, but and then click the enroll button. But we're going to have to talk to them over and over and over again. And they also need to hear the messages from trusted messengers. So community health workers, healthcare providers, family, friends, that amplifies, that turns up the volume on your messages as well. When they hear it from someone they know and trust, who understands where they are. We also understand that prediabetes is not at the top of their list of worries. There are other issues that take a higher priority for them. And as a result, they need a more personal touch. They need to understand why this is important for them. That is not always health. And we need to connect with those things that are meaningful to them and meaningful for sort of the way they want to live their lives and the futures they want to have for them and how we match that. They also need to feel like they can be successful. When we talk about people who are at risk for type 2 diabetes, this is usually not the first time that they've heard that something that might need some improvement in their lifestyle. Many of them have tried weight loss before, or they've tried being active before, or they were active before, and things just, other things got in the way of that or became a higher priority. And they may feel defeated, and they may feel like, yeah, I've been there and done that, and it doesn't work. So they need to feel like they can be successful. We need to address those self-efficacy issues that they may have. And we also have found that we need to focus on readiness in addition to awareness. So we know that there is an awareness gap, that people don't know what prediabetes is. They don't know that they're at risk. But we can't go just from awareness to enrollment. There's a phase in the middle of, okay, I found out I'm at risk. I have to figure out a way to finally feel confident to enroll in a program. And a lot of times we push people from finding out you're at risk to trying to get them to enroll in a program, and that doesn't lead to retention. So we need to really work on getting people ready to be a part of the program. So the successful approaches that we've seen used are really audience driven. So meeting people where they are, not deciding that we know what they need or we know what they need to know, but listening to them and meeting them where they are. Because when we do that, when we sort of fling things at people based on what we think, they don't respond to that at all. But they do respond to the things that resonate with them and what's meaningful to them and where they are in their lives. It's important to use a mix of approaches. So our more successful partners are using in-person, they're using media, they're using public relations approaches, they're using champions in the community. So that goes back to cutting through the noisy environment and people having to hear the message more than once. They need to hear it over multiple channels. It's really important to leverage the stories of participants and coaches. It's those stories that really connect with people, particularly our priority audiences respond to stories, and stories where they can see themselves, and stories where they can see people like them being successful. And engaging program champions. So that's your people who have been through the program and been successful, people who are in the community and believe in the program, and are out there talking about it. So it's really important to have these people as champions talking up your program, and your coaches, and having your coaches really talk about it, because that's who they're going to engage in the program with. We found that our audiences really respond to a positive message that tells a compelling story. So not sort of fear-based messages around the risk of type 2 diabetes and all the things that come with type 2 diabetes. It's important for people to know that, but it's important for people when they're entering a year-long program with you to feel like there's hope, and that change is possible, and that they can be successful. And that comes from a place of positivity and sort of not a place of fear. And my advice, whenever I'm working with our states or our recipients or our other grantees or our other partners, is to turn up the volume on whatever it is you're doing. Do more of that. Again, it's got to be multiple channels. It's got to be loud. People need to hear it multiple times. And so usually what we see is people have done one or two things, and what they need to figure out is how to amplify those one or two things that they're doing by increasing the frequency and the mix of the channels. And we'll talk a little bit about how you do that. So in terms of meeting your audiences where they are, it's about finding the right partners, the right messengers, being on the right channels with the right messages. And partnerships with faith communities, work sites, community centers, going out to events. It's really important, as I said, to have either community health workers, program champions, and coaches involved in the program, and making sure that you're actually on the channels that your participants are paying attention to, whether that's social media, radio, newspapers, outdoor media. You have to really understand where it is, what it is they're paying attention to, and be on that channel with the right message. Fine. So how do you get the message right? And as I mentioned earlier, we tend to focus on knowledge and action, and knowledge is so important with this program because of the lack of awareness of prediabetes and people not knowing that they may be at risk for prediabetes. So knowledge certainly is important, but we all know that knowledge doesn't equal behavior change. We tend to raise a person's awareness and then try to get them to drop into a program, which is fine for people who have already been thinking about it and are ready to take action. But all of those people that are sort of in between that stage of, I didn't know this was a thing, to I'm ready to take action, we have not done a good job necessarily of reaching those people who are thinking about, who are in contemplation, or who are in preparation. So we need to think more carefully about how we move those people and how we get them ready to engage in the program. And we think the way to do that is we really need to focus on the meaningful benefits of the program, not just prevention of type 2 diabetes, which is certainly meaningful for a lot of people, but also being a good grandparent, having a healthy retirement, having less stress. So what are the things that are meaningful to your audience? It goes back to knowing your audience. Again, addressing that issue of self-efficacy and people feeling like they can be successful. Our program needs to be in the way that we approach communicating about it more trialable, and that people can try it out and that they can see that it's fun and it's engaging, and we're not going to nag you or fuss at you, but we're going to find ways to work with you and work with what fits your lifestyle. So how do we help people taste little bits of our program? And again, the frequency of communication, you have to say it over and over and over and over again before people will finally say, you know what, I'm ready and I heard about you, and so I'm going to join your program. The messaging has to be positive and it has to tell a compelling story. Again, it goes back to understanding your audience. And also think about how you build a relationship with them over time, especially for those people who are not ready to take action. So you're going to have to talk to them multiple times, which means you're going to have a compelling story to tell them. They're not going to engage with you if it's sort of the same thing over and over again. Your core message can be the same, but you have to find ways to present them with content that they want to see and want to hear about. So you want to identify those authentic stories. You want to ask them those engaging plans, those engaging questions. So one of our grantees, one of our summer promotions was summer fun, and we talked about all different ways to have fun in the summer and spend time with your family. But embedded within those messages was also, if you want to learn more about reducing your risk for type 2 diabetes, call us. So we have to find ways to connect with people over time. Don't forget your key messages though when you go out with those compelling stories. And remember that everything tells your stories. Your visuals, your messages, your branding, all of that goes into making one message that will resonate with people. So people aren't hearing or seeing different things that they think are coming from different places. When all of your look and your feel and your messaging is telling the same story, people realize it's you. It makes your message louder. Next. We also talk about public relations and not just advertising. And so public relations is a communication process that is based on building relationships in order to motivate people to carry your message for you. So if you think about advertising, you might buy an ad on a radio, and that's a radio station. That is advertising. If you send a coach and a participant to do an interview on a radio station and talk more about their story of the program, that is public relations. And what public relations does is it builds your credibility. It allows you to tell that story. It's an effective way when done in conjunction with other activities to really amplify your message and cut through the noise and have people hear who you are. And so we found it effective to build relations with people, places, and organizations who are where your key audiences are and will share your story. That includes private and public sector partners, the media. It uses a lot of word-of-mouth strategies and engaging people who are influential in the community, and especially working with champions. Next slide. It's a good use of limited resources, and as I said, it can cut through the noise and enhance your credibility. The key to making it work is to make it easy for your champions or your influencers to share your story. So that means having your messages already prepackaged for them so they can just go out and deliver your key messages. And it means thinking about, it's a strategy we call create once, use everywhere, where if I'm at a public event, how do I share that public event on social media? How do I write an article about event? How do I get that event on the news? So think about how your individual promotion activities have more legs. You get more bang for your buck that way. And then it's also about integrating your efforts and making sure that you're making the most of your promotion opportunities. Don't be afraid to repeat yourself. I think I've repeated my core messages over and over and over again, because that's how you get through to people. I had a marketing professor that said, by the time you're sick of your message, your audience just heard it. So don't be afraid to repeat yourself, create once, publish everywhere, and make sure that all of your messaging is integrated. So are your messages for people at risk, providers, insurers, employers, all driving to the same behavior of enrolling in your program? Is it consistent across your promotion efforts, your website, your social media channels? Are your coaches, your participants, your educators, the referrers, are they all delivering your key message? That is part of how you make it louder. When all of the voices are singing the same tune, it sounds louder. If everyone's saying different things, then it gets too confusing for people. So you want your efforts to be integrated in order to raise the volume on your efforts. Okay. So let's talk a little bit about, so you've done all of that and you've got the people enrolled in the program. How do you keep them engaged? And what we've learned a bit about what makes an engaging class is this supportive group dynamic where people feel supported by their peers, where they feel good about coming to class, where you're using active coaching strategies that keep people engaged, that include physical activity, that include games that are fun. People still want that one-on-one attention. They want to feel validated. They want to feel recognized for the successes that they're having. And they need the appropriate flexibility. So things like makeup classes and extra classes if they need them seem to be really important to keeping people engaged. This means staying participant focused. So we talked about you being audience driven in your marketing and your implementation, your participant focused. Again, you got to understand their why. Why are they there? What's important to them, and how are you meeting those needs instead of deciding for them what they need? Tailor for language and culture. We offer the curriculum in Spanish. We're also working on translating it into different Asian languages. So if you visit our website, you can find those resources. It's important to address their resource needs, particularly with priority audiences or underserved populations, have elder care issues, child care issues, transportation issues. And while you might not be able to fill those needs, you can certainly serve as a resource to help them. So if you're connected with your area agency on aging or the food pantry or with other community-based resources, that makes it easier for them to stay engaged in the program when those other resources are being met. And be aware that their needs will change over time, that you'll need to adjust their confidence in their beginning, and you'll need to address them feeling resilient and the ability to do this on their own as you get to the end. So just be sensitive that their needs will change over time. And this means supporting your coaches. And your coaches will need ongoing training and mentoring. We're starting to look at how we provide advanced training to coaches. They need to, their skills will develop over time, and you want to keep those coaches engaged and retained in the program just like you keep participants engaged. So it's important to recognize their contributions to their program and show them that they have a way to grow with your organization so that they feel like they're valuable members of the team, because they really are where the rubber hits the road with this program. So just some resources for you. The first place you go is our website for the National Diabetes Prevention Program. That's where you'll find our marketing resources and our translated resources and our curriculum. There you'll also find access to our customer service center, and there's a lot of information in the customer service center about how to do some of this work. If you're interested in developing a marketing plan, we have a marketing and communication toolkit that will walk you through the steps of developing a marketing plan. And coming soon, we have a champion toolkit that will help you develop and make good use of the graduates of your program, the people in your program as program champions. And you'll also be able to continue to share your lessons learned with us through the Customer Service Center. So we're always listening back to the field about what their needs are and what's working for you. So Um, that's it for me. Thank you for participating in this webinar, and I'd be happy to take any questions you have when we get to the question and answer section.
If anybody has a burning question right now, please feel free to put it in the chat box. So some people have been writing questions in the chat box. I've been trying to answer them as they're coming. If you have any question and you'd like it answered right now for Alexis, please go ahead and type it in there now. Great. And I have used the resources available on the CDC website, these marketing resources, and they have them for different population groups. They're very helpful. I know that with Virginia Cooperative Extension, we have tried to implement some of those things that Alexis talked about, developing centralized marketing materials for our program in Virginia so that everywhere our agents are conducting the program, they're using the same materials with the same look and the same messages. So trying to establish consistent messaging through our Virginia Cooperative Extension is something that we're doing. So I don't see any other questions coming forward, so I think we'll move on for our next presenter. And Janice, if you'll go ahead and try to share your screen, I'm going to stop sharing mine. And while she's doing that, I'll go ahead and introduce her. So Janice Herman received her bachelor's, master's, and her doctoral degrees from Kansas State University. She's a registered and licensed dietitian. Janice is the Oklahoma Cooperative Extension Service nutrition specialist at this time, and she has been with Extension for over 34 years. Her area of focus is older adult nutrition and health promotion, and Janice is facilitating the diabetes prevention program in Oklahoma. And last week, Oklahoma Cooperative Extension Service trained 12 Extension County educators as DPP lifestyle coaches who will begin implementing the DPP in 2020. And Janice, are you able to share your screen?
Am I sharing?
I don't see it.
So let me try again. Screen one, share. How's
there
that?
You go. Now we're seeing it. Very good. And if you put it in presenter mode, perfect.
Okay. Thank you for helping me there. I'm just going to be talking about providing the CDC diabetes prevention program to Native American audiences. So we'll just start. I think one thing that's important to understand is that Native American tribes are sovereign nations, and that's really important, that they are their own sovereign nation, and they have their government and they have their way of operating. And so it's important to, and every tribe is going to be different. So you really want to learn about the culture and traditions of the tribal communities you'll be working with. And one thing I'd recommend is maybe to find a mentor within the tribe who can help you with that, to be an observer. Like my mentor, you may not realize it, but there may be codes within that tribal community on even how you dress, and what's allowed or not allowed, or not encouraged. It's not that it's not allowed or disallowed, but ways that they encourage educators or to dress within the community. One thing I'd like to just highlight, every tribe's going to be different and have different cultures. I mean, I did one thing where we were doing focus groups with some handouts, trying to develop handouts for a certain tribal community, and they recognized right away that the colors were not their community, it was another community. And so, or that the regalia was a different tribal community. So really learning about the tribal community you'll be working with is important. Elders and community leaders are very important in tribal communities, and they're highly respected for their knowledge and their wisdom. The family is very important in tribal communities, And a lot of things revolve around the family. And usually the whole family is involved. And there's a lot, either they may live together or they may have a lot of events where they get together as a family. So the family is a very important component. And the larger community is also very important. And sometimes helping others is more important than helping self. So when they're helping themselves, if they can also be helping others, that can be a way to use that as far as some of the education. Courtesy and respect are very important. It's more important that you listen than talk, which really works pretty well with the diabetes prevention program, the way it's set up, because you are encouraging, you are just facilitating. You're not the one just standing up there telling people what to do. You're facilitating them. And so it's very, it's important to listen more than talk, and also that you don't interrupt. Let's see if I can do this. Another thing I'd like to mention as part of learning that culture is learning the organizational structure, learning how things are decided to be presented. You just don't want to go and say, I want to present this program to your community. You want to find out who are the people you need to talk to, and they may need to talk to people at a higher level within that, such as when I'm work with one group, with one nation, and I can offer something or talk about it, but then they may have to go to the director of that program, and then that director may talk to my director, and they'll make the decision, and then I'll be told. And so I don't just go in and say, I'm going to do this. And usually I can offer something, and then they will contact my coordinator or director to ask for me to do it. Let's see. Just a little bit about providing the diabetes prevention program. One thing is that if you can engage someone who is knowledgeable and recognized and respected within the community, that will really help. They will know the best ways to market. They will know how to get the word out. And so having someone that maybe is helping you, who's a respected and recognized individual in the community, can really help. It's really important that you take that time, as previously mentioned, to build trust within your group and to build that community within your group. If you can build the community, as you know, with the diabetes prevention program, you're facilitating them to come up with ideas for ways to eat healthier or be more active. And they're going to share better once that trust community has been built. And helping each other is really important. Helping each other as a community is really important. So again, you're just a facilitator, and you're really allowing that group to help each other. And that's really important. Again, it's not you as an outside person trying to say, this is what you need to do. You let them come up with those recommendations. I think one thing that I'd also mention is trying to dispel the myth that diabetes is their destiny. It's not their destiny. And that it's trying to change that message that you can make lifestyle changes that can lower your risk of developing type 2 diabetes, and being that cheerleader for their lifestyle changes can lower your risk. Again, I kind of alluded to this, but the facilitative style of the diabetes prevention program really works well. Again, as a facilitator, you're facilitating the group to come up with their ideas and suggestions, and for ways to eat healthier or to be more physically active. And again, building that support within the group so that they're coming up with the ideas and they're supporting each other, that's a lot better than you telling people what to do. And I think storytelling is really important, and sharing their stories is really important. And so that works really well with the diabetes prevention program, the way it's set up. So they like to tell about their story and share their story, what they've experienced and how it's affected their family. And so again, that gets into the larger community. And so there are a lot of stories they can share about their families. But again, it comes from them. One thing is, as far as, again, if allowing people to respond, sometimes there may be a slower wait time for responses, and that's okay. You don't want to jump in and start providing the answer. Allowing the group members to come up with suggestions or ideas. It may be that the elder will speak first. So you may want, again, and a lot of times if the elder speaks, no one interrupts, and there's not a time limit on the elder. And so you may want to think of some other creative ways to facilitate groups discussion, such, like the carousel method or something else where you're just encouraging them to speak from their views. Let's see if I can. Oh, I just wanted to talk a little bit about food. It's important to know where and what foods are available. In case Native American nations can often have the food distribution program on Indian reservations, and Native American communities. This is the food distribution program on Indian reservations provides the foods to low-income eligible households living on Indian reservations and to Native American households in designated areas near reservations or in Oklahoma. In Oklahoma, we don't have reservations. They do have to choose between having the food distribution program or SNAP. They can't do both. So you may also want to know about food pantries that are available. And so becoming familiar with what foods they are familiar with and what foods they have access to is important. And make sure that if you have any recipes, you're using foods that are available. And I also think it's really important to understand about the importance of food and celebrations. That may not be the place where you want to start, again, if that's a place they want to go to with making some lifestyle changes, that's fine, but it comes from them, not from the outside. I talked pretty fast. That's it. Let me stop sharing if I can figure out how to do that. There. Carlin?
Sorry, I had muted myself and forgot to unmute myself. Oh, thank you, Janice. That was very informative. As things I hadn't even thought about because I have not done programming with the Native American community. If anybody has any questions, please jot them down in that chat box. Janice, if you can see the chat box.
Yeah.
Good. It kind of disappeared from my screen. I'm going to share. Can you all see my screen now? Can you see my screen now, Janice?
Yes.
Good. So this is Janice. Here's another picture of her in her presentation. I just wanted to make sure there wasn't a burning question somebody had in the chat box right now that we could respond to. And for some reason, it's not coming up for me. So Janice, I don't know if you can see it and see if there's any question for you there. You could just read it out.
Just Emily indicated that knowing about the culture is very important point.
Oh gosh, and that's sorry, that was something going off in the room. Okay. I'm sorry, Janice, what was Emily's question?
It was more a comment. She just
Okay.
commented that knowing the culture is a very important point to the prevention process.
Okay, great. So if you all have any questions, please make sure to jot them down in the chat box. But we'll move forward with our next presenter, Antonio Villa Payares. And Antonio is a medical doctor. He received his medical degree in 1991 from the University of Guadalajara in Mexico and specialized in health administration at the same university. He worked as a physician in his home country of Colombia from 1993 to 2004 in various positions, including as the medical director of the Kennedy Hospital, founder and director of the St. Teresa Medical Center, and the director of Integral Health Services. He came to the United States with his family and received a Master of Public Health from Virginia Commonwealth University in 2013. He's the founder and CEO of La Casa de la Salud, which is a nonprofit organization that links individuals from the Hispanic community with resources to meet their health and socio-environmental needs. And without further ado, Antonio, take it away.
Thank you. Thank you, Carlin, for this invitation and give me the opportunity to share with audience today our DPP at La Casa de la Salud. Before I start with the DPP at La Casa de la Salud, I want to give a brief introduction about La Casa de la Salud. La Casa de la Salud is a very new organization. We start in 2014 with an initiative based on the top health priority from different needs assessment. As you see, lack of access to healthcare services, clinical preventive services, need for interpretation, language barrier, all those difficulties that Hispanic have in the Central Virginia area to have access for healthcare services, as well as health general information. We began as a nonprofit in the same year with the support with the health department. We start the DPP. We apply for the DPP as a DPP provider, recognition at the CDC. We start this work with the community health worker, connecting, serving as a bridge between La Casa de la Salud and the community. And it's very important for the audience to know that the Hispanic community is very diverse. We have Central American, South American, Caribbean, and Hispanic, all of us with some differences, especially when we are going to do any intervention in the community, in this case for the DPP. Those differences, we have data that report educational differences, behavioral differences, just the way that we express ourselves. That's a very important part for our DPP program. A specific experience that we have in our DPP group, Central Americans tend to express themselves in different way than we can see, for example, Caribbean, South American, Spaniards tend to speak loud, they are more open, and Central American tend to be a little more quiet, serve and share their experience, and that is the biggest population that we have Central America in the Central Virginia area. The family is a big part of this issue, providing DPP. We provide DPP for individual, but we have experience where we have noticed the involvement of the whole family. That are stories that the participants share with us. So we start implementing activities, cooking demonstration. We invite the whole family. We have events in our site that we have. That site usually are churches where we can implement event where the whole family can share with the church or the community in general. There are some specific issues that I want to point out, food related about Central Americans with South American, Caribbean. Central American tend to eat more tortillas, and that is the base of the dishes every day, while we see Caribbean, South American, with eat rice every day in our dishes. Music and religious issue is another other issue. We have recent situation with physical activity in our current site that we have a group where they plan to have a Zumba session in the church. I wasn't sure. It was probably the noise for the Zumba, the music, but they had to make that plan in a different place because that was impossible. That's one of the probably of the issue that we are very flexible. We are very open in terms of the preference for all the religious preference that all the member and participant has. It is important also for us include the family. Diabetes is not just the only concern that the family have or the participant. They have any other health issue, and that's the community health worker help the participant, the family, with any support that they need for any health issue. They coach the participant as well as coach the family when they have any health issue. In our model at La Casa de la Salud, we have some improvement that we noticed the success of this improvement. We trained 12 community health workers as a lifestyle coach. They have all their experience facilitating the coaching, health education, referral to provide that medical support. That support is given to those participants, as I mentioned, also for the family and the surrounded community in that site that we have. We have different partners where we send those referral clinical services or any other resources, and the community health worker work close to those organizations, facilitating those resources. It can be housing, it can be immigration, or any other need that the family or the participant has. And we align all this work in a model to address the social determinant of health. We align all this work with the state and federal policies in order to work together with other organizations in a collaborative manner to provide all the support that participants, families, and again, the whole community need. That have been working well for both sides, for the community as well as organizations that want to engage the community and patients in their programs. Some specific issue, and again, that we have in our group to adapt the program, the lifestyle coach, as I mentioned, the community health worker, most of those community health workers are participants are female, and they serve as a peer as well as participant supporting the group. Most of them tend to be the same country of origin. They work together, the facilitator with other community health worker that help the facilitator in their sessions. The participants choose what are their preferences in terms of food, physical activities. The facilitator is very flexible and very open and listening all the time the participant preference. And they have a social time different than the time that they have in the session that we have in the curriculum. Usually, they use the WhatsApp also as a peer support between sessions. They share information related. It can be a recipe, it can be any discount in food, any information that they consider necessary. They use that digital information on a WhatsApp group that they have that opportunity to interact between sessions. That helps us in the group for sustainability and during the year of this group. One of the big challenges that we have is that we work with most of our participants are uninsured. We have been working through grants. It's not easy to sustain different core when we complete a core. So this sustainability of the program, we have been introducing with this model other type of support. We have noticed that there are some interest for a sponsor that belong to the church or the community when they see the benefit, not just for the DPP, but for the group and the community health workers, that most of them are volunteer advocate that work in the community. They're willing to provide that support. This is new. We start with this process this year. In addition to the sponsor that are a small business that belong to the community, most of them Hispanic, participants also make a partial payment. Churches that we work with them are more open for fundraising activities. They allow us to do any events and other activities that we have this year, and we are planning different activities together with the group of the community health workers to have donation or other type of fundraising for the site that we have at this time. Other big challenges that we have is the schedule that participants have in their work. We have to make some adjustment in the time. Usually we have that in the evening after work. But sometimes we have to adjust also the date. Other challenges that we have is the child support. We have volunteer from the side, from the church, community health worker, but it's still difficult, and it's difficult to have all the day coverage for the child support. Immigration issue. This is one of the big challenges that we have today. And we have an event recently where one of the sessions was canceled because one of the participants sent a message through the WhatsApp that ICE was at the street and no one showed up. They shared that information. Well, we found one of our partners to provide a different session, talk to them, the community health worker and other leaders in the community about immigration, about rights in terms of immigration, what to do. Those group of lawyers offer also to them, in addition to the information, the opportunity to work with them for a specific situation. all those, this specific partner or situation has demonstrated that help us to keep the group together, supporting the group in many different ways. As I mentioned, keeping in mind the social determinant of health that participant needs is not just that they are aware that the risk that they have for diabetes. Thank you. I appreciate very much the audience. Stay with us. Any question, please let me know.
Okay, thank you. Does anybody have any questions? Janice, I'm going to ask you to help me out because for some reason my chat box won't come up, so I can't see the chat. So I'm going to depend on you, Janice, for potentially reading any questions that may have come up in the chat box. Do you see any?
One from Sandra. I would like to know the roles of various extension personnel in organizing, marketing, and implementing the DPP. For example, what are the roles of extension specialists versus county educators versus other staff or volunteer? I'm trying to get a handle on what resources are truly necessary to obtain accreditation and to fully implement the DPP given our extension structure and resources.
Yeah, so Janice, I don't know if you want to touch on how you guys are handling it in Oklahoma?
Well, in Oklahoma, I'm acting as the facilitator for Oklahoma Cooperative Extension Service. So I'm working on getting Oklahoma Cooperative Extension Service recognized. I'll be turning in the data and working for that recognition for the state extension as a whole. But then we have different sites, which are the county educators who will be doing the program within their counties. But I'll be the one they send the data to, and I'll be the one inputting the data and working for recognition.
Mm-hmm.
Isn't that how you do it?
Yeah, in Virginia, we actually considered how we wanted to do it early on. I guess we started thinking about this around 2015, whether or not we wanted individual counties to go for recognition on their own and just to manage their own programs, or we wanted to do it centrally as a state a cooperative extension service applying for recognition through the CDC. And we decided to go as Oklahoma has, as a state. And that actually, I think, has worked. I'm really happy that we've gone in that direction. But you're right in your question, Sandra, that it does require some resources. I'm an extension specialist, and really in Virginia, I have been driving this move forward, particularly the infrastructure necessary here in Virginia to collect the data, send that data to the CDC, and we're moving towards being able, setting up systems so we can become a Medicare provider to submit claims to Medicare and other insurers. And in our state, it is myself, and then I have formed a team of extension agents and also an extension specialist from Virginia State University that we work as a team to move this forward. So it's a team effort, and somebody does need to step up and say, hey, I want to make this happen in my state. But it could just as easily be an extension agent if they've got the time and the desire to do that. I also know in other states like Florida, they went for a county model. So each county agent applies to the CDC for recognition. And you've had extension agents who were just really gung-ho for this program and have actually become recognized there in Florida. So you can do it that way as well, but I think when it comes to being able to submit claims and that kind of thing, that becomes very difficult for a single extension agent to do. So that needs to be kind of an organizational decision, and you need a lot of the organization to be involved in setting that up. So that would be my advice. And if you'd like to join one, you don't have to join our Cooperative Extension NDPP group, but you could join one of our calls, and we have lots of different representatives from different states who are doing things differently. So it's a nice opportunity for you to just ask people lots of stuff if you'd like to jump on one of those calls. You can email me or Janice for that. And matter of fact, I will switch my slide. So here is, I'm Carlin, and I've put Janice's email up there as well. So if you'd like to contact either one of us, with further questions, or you want to get an invite into our next meeting, we meet bi-monthly as a group, I'll be happy to provide that to you. Janice, do you see any more questions coming up on the chat box?
There was just a question from Leslie to me about
Okay.
if I'm about the T2 curriculum. We trained on the 2012 curriculum. There's a little bit more content in the 2012, but when I talked to the master trainer, she said people have gone from 2012 to Prevent T2 or back from Prevent T2 to, I think as a state, it's good if you're doing it with multiple counties. I think it's good to have the same curriculum and you can build those. The trainer also said we could just pull some of the additional information from T2, Prevent T2 into the 2012. And there was a comment, just a comment that someone lives in Texas and they wish they had an organization like La Casa de Salud.
There you go, Antonio. I don't know, Antonio, if you know of any, if you have any colleagues in Texas that you work with or who are working to provide education in the Hispanic community there in Texas. Do you have any connections there?
No, and it's a case mentioning about type 2 diabetes and has some difficulty with the, but I don't know any there. What I suggest is to contact us through Facebook and we can provide more guidance through that way. That's what I respond through the text.
And the only other question I've seen is monthly meetings are via Zoom, question mark. What are the meetings about?
Yeah, monthly meetings are via Zoom, and there's a Zoom invitation that I can send out to you. They're very structured meetings, so we've got our work groups and we've got our goals for the year, and we report out on our advances with those work groups. In the coming year, of course, we're heading into 2020, and so we'll go through a process of re-establishing our goals for the coming year, which is nice, and then we work on those and report out what our advances have been with that. And there's always a time for lots of questions, and there's always discussion because everybody is experiencing things, and we all have questions for each other. So we're all learning from each other through that meeting.
And Leslie also asked about adapting images to move to the make it more applicable to the Native American community. No, we haven't done that. We'd almost have to, because you download that whole curriculum, the participant curriculum, and I'd have to look. I'd like to do that, but I need to look into that.
And maybe I can pull in Alexis at this time. Alexis, is the CDC, because I know you've adapted materials for the Hispanic community, African American community, and now you're working on actually languages in for different Asian populations. Are you all doing anything with the Native American community?
We are looking at the possibilities of developing a photo bank.
Yeah.
So what we recognize is that a lot of this work needs to be local, like the tailoring for culture and food, and those things need to happen locally. But the expensive part might be the images. So that we're looking at, what is the feasibility of us developing an image bank? And it would probably be gradual. So we would probably start with, say, Southwest and maybe Alaska and Northwest, Northeast.
Right.
So we would go by region because the images are different too, based on where you are. But that is one of the approaches that we're considering at this time.
Great. And our group, CE and DPP, has Alaska. We have Alaska representatives in our group, and they're doing some good DPP work up in Alaska as well. So, I think we're going to go ahead and stop there. If there's nothing else right now, Janice, on that chat box, I think we're about 3 minutes over time. You all will be receiving, I think that the Zoom meeting system is going to send you a quick little survey just for you to answer, and then I will be sending a follow-up email with a link to another survey we'd love for you to answer, because we'd like to plan webinars for the coming year, and that gives you the opportunity to tell us what other kinds of webinars would be beneficial to you, and we'd love to meet your needs in that way. So if you would take time to answer that. I'll also send you a copy of these PowerPoints, so you'll have the PowerPoints for you, as well as we record these webinars. So I'll clean it up a bit and we'll put it on our website, and I'll send you a link to that as well. So we appreciate your attendance. I want to thank Alexis and Janice and Antonio for taking the time to provide the presentation. We really appreciate the information you've given, and hope you all will work on strengthening your DPP programs. And with that, we'll end the meeting. Thank you all.
Thank you.
Thank you.
Thank you. Thanks.